Chapter 25, Drugs for Diabetes. Chapter 25, Insulin. Chapter 25, a list of objectives. Blood glucose control. Normal levels are necessary for the body to make energy. Normal levels are measured in our blood. Normal levels are 70 to 100 milligrams per deciliter. Food intake normally elevates blood glucose. As blood glucose elevates, it's known as hyperglycemia. Between meals, blood glucose may drop. As blood glucose drops, particularly below normal levels, it's known as hypoglycemia. Insulin will stabilize these blood glucose levels. That's known as euglycemia. Extra glucose is stored as glycogen. The pancreas makes two hormones, insulin and glucagon. They are important for using the right fuel for the body. Beta cells of the pancreas make insulin, and alpha cells of the pancreas make glucagon. The target tissues of insulin are skeletal muscles and fat cells. The target tissue of glucagon is in the liver. Together, insulin and glucagon ensure that the right amount of glucose is always present to provide enough energy for proper body metabolism. The energy of each cell and the amount of work performed within the body. Diabetes mellitus is a disease in which there is abnormal glucose metabolism. There are two types, type 1 and type 2. Type 1 can occur from a viral attack on the pancreas. This is where the pancreas cannot make any insulin, so the beta cells are not functioning, and daily insulin injections are required. Type 2 is the more common form and very prevalent amongst Americans. It's related to genetics and obesity. The pancreas makes some insulin, but less insulin gets into the cells, so the body does not use the insulin properly. Both types cause hyperglycemia, and both types can cause hypoglycemia. Both types can cause serious complications without proper treatment over a period of time. The balance between insulin and glucagon action keeps blood glucose levels in the normal range. Ketoacidosis is a complication of type 1 diabetes, resulting from excessive buildup of ketone bodies when cells use fat instead of glucose for fuel. This is a very emergent state. Insulin is important for all types of metabolism. Symptoms of diabetes mellitus. They are known as 3 Ps, polyuria, polydipsia, and polyphagia. Polyuria is increased urine output, polydipsia is excessive thirst, and polyphagia is excessive hunger and eating. Again, blood glucose levels. Normal fasting blood glucose is typically less than 100 milligrams per deciliter. A pre-diabetic will exhibit blood glucose levels of 100 to 125 milligrams per deciliter. A diabetic will present with greater than 126 milligrams per deciliter. The hemoglobin A1C is a blood level that measures average glucose levels over 2 to 3 months. The goal is less than 6%. Insulin therapy. Insulin binds to insulin receptors, allowing glucose to enter the cells. The intended response is to maintain glucose levels within a normal range. To eliminate glucose, acetone from the urine, and to keep blood levels as close as to normal range. The side effects from insulin therapy can be site infections, lipohypertrophy, and lipoatrophy. Adverse effects from insulin therapy is hypoglycemia, very low blood sugar. Regimens vary with insulin therapy. It can be a single daily injection, or it can be up to 8 to 10 injections a day. Insulin therapy comes as injections. It is not oral. So why can't oral insulin be used? Insulin is in small protein and it is destroyed by stomach acids and intestinal enzymes. Insulin types vary by how fast they work and how long the effects last, and whether they are synthetic or come from animal sources. What is lipohypertrophy? The swelling of fat tissue. What is lipoatrophy? Uneven loss of fat tissue resulting from tissue responses to impurities such as beef or pork insulin. Why is hypoglycemia dangerous? Brain cells are sensitive to low blood glucose levels. The patient may become unresponsive very quickly and die. Here is a chart of preparation of insulin. Notice there's rapid acting, fast acting, intermediate acting, and long acting. For example, the long acting Lantus has a duration of 24 hours with no peak. In other words, that insulin needs to be given every 24 hours. It also cannot be mixed with any other types of insulin. Rapid acting begins acting within 3 to 5 minutes of injection. And then there's fast acting and intermediate acting insulins. Before administering insulin therapy, check the drug order and check the calculation with another licensed health worker. Also, always note the blood glucose level and when it was checked last. The patient typically must eat within 15 to 30 minutes after the insulin has been given. Use the correct type of insulin and use the correct syringe. Do not shake the vials. Just roll them in the palms of your hands. Insulin is given subcutaneously and you do not aspirate or massage at the site. Insulin drug errors are very common and have serious consequences and including death. It is important not to interchange insulin types and to ensure that the dose prescribed is the one given. If a meal is delayed and the insulin was given, the patient could become hypoglycemic. Do not use rapid-acting insulin, short-acting insulin, Lantus, if the bottle is cloudy. There may be particles present in the vial. Always check the expiration date. After insulin therapy, monitor for signs and symptoms of hypoglycemia. What are signs and symptoms of hypoglycemia? Confusion, cool, clammy skin, tremors, headache, hunger, sweating. Remember a easy saying, cool and clammy, need some candy. Patient teaching. There is a lot of patient teaching that goes along with the diabetic disease process. Insulin only controls blood sugar levels. It does not cure diabetes. Diet and exercise are also very important in the management of diabetes. Hypoglycemia. It's when the blood glucose level is less than 40 milligrams per deciliter. Why does hypoglycemia occur? It can occur from missing a meal, excessive exercise, or insulin administration errors. More insulin was given than there was glucose in the blood. Here are the signs and symptoms of hypoglycemia. Remember, cool, clammy, need some candy. Hypoglycemic treatment. Glucagon, which can be administered intramuscularly, intravenously, or subcutaneously, or IV dextrose at 50%, known as D50W. Both of these need physician's orders. Lifespan considerations for insulin therapy. For pediatrics, diabetic control is challenging. Parents must learn how to manage the disease and make the pediatric accountable. Pregnancy and breastfeeding. Insulin needs to be adjusted during pregnancy. Diabetes is very difficult to control. Insulin is safe to use while breastfeeding. Most children dislike being poked with needles and being different from their friends. They may have daily differences in the amount of food they eat, therefore they'll have daily differences in the amount of insulin they need. These differences can have a good or bad effect on their glucose levels and can create a real challenge. Because complications of hyperglycemia begin even at the childhood years, good glucose control is needed at any age. Good control is achieved using intensified injection regimen with short-acting insulin and the long-acting insulin. So short-acting for meal coverages and long-acting for a 24-hour day. Lifespan considerations for insulin therapy. Older adults may have problems with dosing, monitoring blood glucose levels. However, technology is becoming more helpful to the elder client. There's a higher risk of hypoglycemia, especially while taking beta blockers and warfarin. It may be harder to recognize hypoglycemic symptoms in the elderly, and blood glucose may be more difficult to control due to poor eating habits.